Maryland Spotlight. It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. Well, it's finally warming up and it's time to hit the ground running. But first, let's get some tips on preventing injury. Joining me from GBMC, Dr. Todd Melegari, orthopedic specialist. Thanks for coming in today.
Thanks for having me. Great to be here.
So give us some tips for preventing running injuries.
Sure. I think when it comes to preventing, there's two components. Number one is preparation, and the second is execution. Preparation basically involves stretching, strengthening, and appropriate shoe wear. When we talk about execution, when you go into a running program, you want to do it in a stepwise fashion. You don't want to just go out and run a bunch after having not done it for a while. You want to do it in increments. We recommend a 10% increase per week. And you want to take time off. You don't want to do it every day. So give yourself off days and your body a chance to recuperate.
Now, talk about how the importance of stretching after a run.
Sure. I mean, most everybody stretches before runs, but a lot of times people forget that it's important, probably just as important, if not more important, to stretch after the run. That's when your muscles are loose and they're flexible, and that's when you can improve on the flexibility and the range of motion, and it can help your muscles relax. So if you just end the run and you just head right to the couch, sometimes that can lead to problems down the line.
And it's good, you were saying, to take some time off. Good to do a little cross training so that you'll use some different muscles.
And that's exactly part of the execution of the running plan. When you do alternate activities like bike or swim, those generally use different muscle groups. So that gives the muscles used for the running activity a chance to rest and recuperate and, again, prevent the chance of injury.
Talk about post-run soreness and whether you should use ice or heat.
Sure. I think there's a lot of debate about this, but I think in general, what I would recommend is that for that initial phase right after the run, ice tends to be a little bit better. Okay, it's going to diminish swelling, diminish inflammation, diminish pain. For the soreness that you might have the day after, that's when I think the heat is better. And the thought process there is the heat increases the blood flow. It gives your body a chance to get the essential cells and nutrients to the muscle to allow the reparative process to occur.
Now, if you're still not feeling so great, how do you know when it's time to see an orthopedic specialist?
Sure, I think it's all about the pain. You know, generally, if you run, you're likely to have some discomfort. But if you stop running or if you take a break and you do things in the appropriate way, then that pain should diminish. If the pain doesn't go away or the pain increases, then that's a red flag. Another red flag is if you have pain at night. And then the last thing I would say is if you can visibly see joint swelling or bruising or redness, then that's another red flag and probably a good idea to have things checked out.
Great. Okay, doctor, we want to direct our viewers to the website gbmc.org, OrthoSPC, if they want some more information or tips. Thanks for coming in today.
Oh, you're very welcome. Thanks again for having me.
And thank you all for joining us on Maryland Spotlight. I'm Kim Knight.